Okay. Hi, my name is Danielle and I'm a nursing student and I'm going to demonstrate the intradermal injection today. So I'm going to be administering a TB test to the patient and I'm going to go ahead and gather my equipment, which is my hand sanitizer. I'm going to go ahead and do hand hygiene. I'm grabbing my MAN2, 2 alcohol prep pads, my intradermal syringe, gauze pad, and then of course my gloves. I'm going to go ahead and just review the 6 rights of medication. And then once I do that, I'm going to check my order and my MAR to make sure it's MAN2 0.1 ml intradermal today. So now that I do have that all in order, I'm going to go ahead and prep my stuff. So I'm going to grab my vial and it says MAN2 and I'm going to check it for cracks, precipitant, any damage to that. And once I've done that, I'm going to go ahead and uncap it. I'm going to take an alcohol prep pad. I'm going to cleanse the top of the stopper, set that down, and I'm going to go ahead and grab my needle, which is the 1 ml needle, and I'm going to remove the cap, and I'm going to withdraw 0.1 mLs, and then I'm going to inject that into the center of the stopper. Invert the vial, and I'm going to withdraw 0.1 mLs. And to make sure that there aren't any bubbles in it. And then I'm going to go ahead and recap it using this one-handed scoop technique. Grab it down here and place the needle back on. So now that I have that complete, I'm going to go ahead and grab my alcohol prep, a gauze pad, and my needle, and I'm going to put my gloves on. And I'm going to go into the patient's room, introduce myself. I'm going to do patient identification. Hi, my name is Danielle. We're going to be administering your TB test today. What is your name?
Skip Rocker.
Perfect. And what's your date of birth?
1/1/1972.
Okay, so we are going to do a TB test on you today. Are you aware of what that is?
Yes.
Okay, perfect. Do you have any questions?
No.
About it? Okay. Are you allergic to any medication?
I am Celebrex.
Okay, perfect. I will make sure that I note that and I show that on your MAR. All right, so go ahead and place your arm like this. And good job, perfect. Okay, so I'm gonna go ahead and use an alcohol prep. I'm gonna start from the center in a circular motion, inside to outside. I'm going to go ahead and go over the 6 rights of the medication again, just to make sure. And the site would be the inner forearm. I have my gloves on. And now I'm going to go ahead and administer the medication. So I'm going to uncap the needle and I'm going to insert it at a 5 to 10 degree angle into the patient's forearm, about 1/8 of an inch. And then I'm going to go ahead and inject, looking for that wheel, which I do have. I'm going to take it back out. And I'm going to go ahead and dispose of this in the Sharps container and use my gauze pad to gently get rid of the excess moisture. And I'm going to circle 1 inch around the area, and then I'm going to let the patient know that he needs to follow up with his provider in 48 hours to have the test results read. And then I'm going to go document in the patient's medical record that he received a TB test.